2005, there was a progressive decrease in cardiovascular mortality and even all-cause mortality.
No, no, I agree that there is plaque regression. With 80 milligram of atorvastatin in IDL and TNT, we didn't get any mortality benefit. Even
Yes,
after
sir.
plaque regression, we cannot show any mortality benefit. Then why do you do it then?
Uh, I wonder this question because plaque regression, in my opinion, ultimately will translate into reduction of long-term mortality. It will naturally translate
That's
into
the
it.
issue that it haunts me for a long time.
Yes.
Why? Why?
Okay, Dr. Pandey. Thanks for a very vociferous and a very strong and a beautiful presentation.
Just 1 minute, can I just...
Let me, there's one small question to you. With your good health and your good sense, do you think one day you'll stand on a podium like this and will advocate statins to be added to the midday meals in our country?
Polypill concept. No, I don't think so.
I just like to give one comment, Dr. Pandey. I think your presentation was outstanding. Excellent presentation.
Thank you, sir.
The one slide which you showed, the umbilical cord, a baby's LDL is just 30 with a very agility, activity, everything is there in the baby. So it's very obvious that at the level of 25 or 30, the so-called cognition derangement is a misnomer. And second point, which you mentioned very rightly, which I really like to re-emphasize here with our colleagues, there is a lot of psychological intolerance among us doctors.
Yes.
When they take statins.
Yes.
It's true. Before they even take it. It's very important. This fear and phobia has to go, which is very important. Third point, I think even Rajiv Karnik, I was listening to him very carefully. He mentioned about so-called omega-3. And you also mentioned EPA and DHA. In India, at least in Asia, Southeast Asia, we find the omega-3 index is very low, less than 8. Especially in adults. I'm not talking about the pediatric age group. And I'm sure if we correct omega-3 along with LDL, maybe we may be able to help to regress and reverse the disease as pointed out by Dr. P.K. Dev. Because P.K. Dev is very particular. All the time you ask a mortality benefit. Morbidity, there is no doubt about it. We give longevity to the people. But acute mortality and long-term mortality benefit are also very, very important.
Yes.
Would you like to give any comment, Rajiv, on this? Would you like to give any comment on this? Thank you.
Thank you very much.
Regarding guidelines,
Thank you. Thank you.
Thank you so much.
Yes, I hope everyone agrees with me on this image. What was the situation in 90s and what is the situation today? All thanks to our lifestyle. So we have a surprise from Dr. Gupta, which he will unveil how we can modify our lifestyle. But before that, we have talk by Dr. Das on lifestyle modifications, what to eat, what not to eat, specifically on the oils. And for this talk, we have chairpersons Dr. Venugopal. I would request him to come on the stage. We have Dr. Vidyut Jain, who is Senior Consultant, Chautharam Hospital, Indore, National Vice President, CSI, National Convener in Hypertension, Sub-Council, CSI and NIC Peripheral Intervention, Joint Secretary of Indian Academy of Echocardiography, Scientific Council member of Asia Pacific Society of Cardiology, SARC Society of Cardiology. He is editorial member of Asia Pacific Journal of Cardiology, Indian Heart Journal, and Journal of Indian Academy of Echocardiography. He has many publications to his credit. I would request Dr. Vidyu Jain to come on stage. And we have Dr. Neil Bordoloi. Dr. Neil Bordoloi, he is the managing director. Okay. Yes, welcome, Dr. Vidya Jain. Okay. So, Dr. Das, so he is the senior interventional and consultant cardiologist, BM Birla Heart Research Center and Calcutta Medical Research Institute, Kolkata. He has been associated with CSI in different roles, namely honorary general secretary and organizing secretary, also as treasurer, vice president, executive committee member, secretary and treasurer of CSI West Bengal chapter. He has presented papers at national, international, and zonal conferences and published more than 60 articles in national journals, textbooks of cardiology, textbook of echocardiography, CSI update books of cardiology, update book of medicine. He has also worked as the editorial secretary of Indian Heart Journal. He at present is a co-editor of CSI textbook of cardiology and faculty and national expert of Public Health Foundation of India. Dr. Das, I'll hand over it to you for your talk.
Thank you. Every cardiologist or every physician is faced with the questions from patients. One, after an acute coronary event or when they come for a checkup, what should be my eating habits? What should be my diet? What is the oil that I should use? Especially when I come from Kerala, coconut oil happens to be one of the most controversial topics, even today not settled among the public mind. So let's listen to what Dr. Das has to tell us about lifestyle modification, what to eat and what not to eat, especially with regard to oil. And India being a country where different regions use different types of oil, I think it is very pertinent that we listen to Dr. Das. Dr. Das, please.
Good afternoon. Are you hungry? No. Okay. Are you confused? You are not confused. Fine. So I can take the opportunity to talk on a subject which I have never talked. So that is my first disclaimer. So when I was reading the agenda sent by Dr. Gupta, I thought that my topic is the easiest one. And I started studying the sort of nutritional aspect of cardiovascular disease. Then I started getting confusion because so many opinions are being offered by different people and also different guideline bodies. And ultimately, I thought that better present the data in a very simpler way so that you are not really very much confused, but at the same time you can give something to your patients. Because as cardiologists, I think all of us have got the responsibility to give advice to the patients so that they remain healthy. And of course, as Dr. Deb was asking repeatedly about the mortality, so that can be beneficial. So with that background, I thought that I will be talking about the lifestyle modification and also to some extent dietary aspect, but found that it will be too elaborate, so I concentrated on the dietary practice that is to be done in our day-to-day practice. Now, CVD tops the list of causes of death right now Out of all the CVDs, again, atherosclerotic cardiovascular disease has positioned itself as the leader. That is from the Global Burden of Disease 2015. Now, what determines atherosclerotic cardiovascular disease are all known to us, especially the modifiable factors and non-modifiable factors. But there is no doubt about that. Diet has got tremendous effect on various aspects or various diseases. And there is a cause and effect relationship between the diet and the diseases. When we discuss about the overweight or obesity, physical inactivity, stress, blood pressure, diabetes mellitus, dyslipidemia, all are the risk factors, known risk factors, which are enshrined in the books as well as all studies, including the inter-heart studies. And when these risk factors are combined together, definitely the morbidity and mortality gets increased. And say, for example, the diet and physical activity, if they are inefficient or unhealthy, then you get 50% or 1.5-fold increase in the development of the cardiovascular disease. So that is the importance of the various risk factors which have got relation to the diet and various risk factors. Now, there are confusions naturally in all the subjects we deal with, but to come to some conclusion or some information which will be helpful for all of us, we have to know where we are going, and also we must know where we are coming from. Because the diet is practiced in a particular country or particular geography is for a long time. So naturally, you'll have to consider that aspect just by the flood of information coming from the overseas or Western literatures, which are who are very much fond of giving us the directions, may not be the true fact in our life. But having said all this, there is no doubt about the fact that lifestyle modification is very, very important, even if you control the dietary pattern and vice versa. And that is why we must take care of the dietary habits in a very, very important way. Now, adjusted risk reduction for cardiovascular disease mortality by fitness and body fat is as per the fitness and as per the unfitness. And you can see that in a lean or in a normal person or in a obese person, the fit, they have got much more less hazard ratio, whereas those who are unfit or who are on unhealthy diet, that they have got the higher mortality or higher hazard ratio. Similarly, the unhealthy diet also has got the effect in the same way. Now the question is, what are the issues of cardiovascular disease and nutrition which we should be concerned about? Is it total energy intake? Is it related to fat intake? If fat or oil, is it quantity or quality? Is it carbohydrate or protein? Role of micronutrients, salt, and cardiovascular disease relationship. Now, in all the topics we have seen good, bad, and ugly. Similarly, in diet also, there are good diet, bad diet, ugly diet. I'll not go into the detail of it, but definitely I'll touch upon some of the points. Are fats bad? That has been highlighted by Dr. Pandey, that it is a major source of energy, and it is responsible for so many steroids and other things, and also for cell membrane, and also it is a very good thing. The fat is very good thing, especially for the surgeons. But bad fat is very bad. Why? Because they contain a lot of cholesterol, especially the saturated fat. And there are enormous number of statistics and papers which have given very much direct correlation between the diet heart pattern as well as or the lipid hypothesis, as is more commonly known. And this bad diet can cause high blood cholesterol, atherogenesis, and ultimately the coronary heart disease, which we must take care of. out of all these, the trans fatty acids are the ugliest one, and major source of trans fats are deep fried foods, bakery products, packaged snack food, margarines and crackers, and they are more atherogenic than saturated fatty acids. Similarly, discrepancy in fat and cardiometabolic relationship with the trans fatty acids are also there, and ultimately, it has been found that whatever you take in the form of diet or cholesterol is actually not absorbed totally. Hardly 6 to 10% of total fat is absorbed in our system. So, if that is the fact, then we must take care of that 6 to 10%, and especially the very, very bad cholesterols, that is the trans fatty acids. Here comes the role of apportionment or portioned distribution of the diet. Now, here is a statistic: 2% increase in energy intake from trans fatty acids is associated with 23% increase in the incidence of coronary heart disease. These are all known. And also known that fat and fatty acids are divided into so many groups: saturated fats, unsaturated fats, polyunsaturated PUFA, MUFA, and out of, again, the polyunsaturated and monounsaturated fats are omega-3 fatty acids, then omega-6 fatty acids, and omega-9 fatty acids. Out of this, again, omega-3 fatty acids is very very important from health point of view. Omega-6 are a little bit more, but omega-9 is also good, but not that to the extent of omega-3 or omega-6. So traditional Indian practice of routine oils and rotating the different kinds of oils is not a bad idea. So that is the message from all the sources, whatever I have gathered, that traditional Indian practice of routine oils, so whether it is mustard oil in the eastern region or other oils in the coconut oil in the southern regions, and North Indian, they use both the white oil and other oils. So this practice is not bad. Now, effects of fat and on cholesterol level, again, very much well known. These have been talked about, especially the saturated and trans fats are very bad for our health. They raise both LDL cholesterol, lowers HDL cholesterol. So in that way, they damage our arterial system or vascular system, and thereby they can cause ultimately the various kinds of complications. Risk of coronary artery disease with various fats, again, directly related to the saturated fatty acids and trans fats, same thing. Risk of cardiovascular disease with replacements of saturated by other fats, conversely, they decrease the incidence of coronary artery disease. So that has been shown here. Trans fatty acids and high cholesterol levels, they also are both in relation to the disease pattern, they go on increasing, and when you reverse it with some good cholesterol or diet, then you are decreasing the diseases. Now, you look at the high fat consumption across India. In the northern Indian population, there is a very high consumption rate of ghee, and in the southern population, it is the coconut, and as well as the ghee. In eastern population, again, it is the oil, especially the mustard oil and cheese, and also to some extent the vanaspati or ghee. Similarly, in West, it is again the vanaspati or ghee. So these patterns are being practiced for a long time. Only recently, possibly they have changed a little bit by the propaganda that are being made over a period of time over the TV and all social media as well as the medias. The high risk of coronary events with dietary changes, obviously, if you change them to the better diet or better practice with good amount of PUFA and MUFA and a good amount of omega-3 fatty acid, obviously the risk rate gets reduced. Reduced consumption of trans fats leads to reduced incidence of CVD, I have already talked about, and cardioprotection with omega-3 fatty acids also helps in plaque stabilization, and that has been already told in terms of the relationship with the statins, but omega-3 fatty acids, they themselves can help in the process of stabilization of the atherosclerotic plaques. Now, this is the relationship between the omega-6 and omega-3 fatty acid. And if you increase the amount of omega-3, it is minimally inflammatory. And the inflammation resolving is very much hastened. That's why some of the drugs were promoted, but subsequently they were taken out because of the fact that they did not show mortality benefit. Same cardiovascular events reduction with omega-3 fatty acids. These are some of the oils which are commonly used in our country as well as across the globe. And I'm not going into the detail of the various oils because it will take a lot of time. But one of the crux points one must take into account that some of the oils we use frequently are having huge amount of MUFA as well as the PUFA, and less amount of the polyunsaturated fat. So in that way, actually, our oils are not bad. So that's why possibly we can go on with our own dietary system or our own oil which we are using. So which oils to use depends on composition of fats, whether it is having more of saturated fat or less of saturated fat, or less of more of polyunsaturated fat. And these are the various the levels which are being shown with the different types of oils: mustard, canola, ghee, soybean, red palm, olive oil, and all. Very interestingly, mustard and I'm giving this some comparison between the mustard oil and the olive oil. The ratio between the N6 and N3 is 1.2 to 1 in case of mustard oil, and the most satisfactory level is 50-50. That is 1:1. Whereas in olive oil, it is 20:1. So you can imagine how much has been the propaganda in favor of olive oil or some white oil. When we are having a better oil or better media for cooking, so why should we switch ourselves to the olive oil, which has got lesser proportion of the omega-6 as compared to omega-3? There are other points which should be taken into account while taking care of the oil. Out of this, refined and unrefined oils. Refined oils means obtained from oil cakes by mechanical or chemical solvent, and they are usually prepared at a very high temperature. And with high temperature, actually, the free radicals that are generated due to breaking of the unsaturated fats, they ultimately cause the oxidizing effect, and ultimately they hasten the process of, the process of the atherosclerosis. So that is why unrefined oils are always better as compared to the refined oils. And more important than these is, if you recook the oil or reuse the oil, you are actually giving more chance of the trans fatty acids to be given to a particular diet, and that will actually cause all the problems. I'll give a few points related to the mustard oil. The various MUFA, PUFA, and all these ratios are given here. N6 and N3 ratio here is near ideal, that is 6:5. And unlike olive oil, as I already told, that it is about 20:1. Lower risk of heart disease with mustard oil. So that is a very important message I would like to that there is lower risk of heart disease with mustard oil if you are not reusing the oil. If you are using it fresh, then it is as good, or rather I'll say better than even olive oil. Vis-a-vis olive oil, as I told, that the limitation is there because of the non-ideal ratio between N6 and N3 ratio. But definitely some of the components have got beneficial effects. It is anti-inflammatory, and it has got inhibition of ICAM, inhibition of MCP production, and VCAM production. So they do good, but if again they are used as a sort of dresser. They are not cooking in the Western countries, they are not cooking the olive oil actually, they give as a dressing agent. And there actually lies the clue that they do have the better beneficial effect with that. So mustard oil and olive oil controversy, I think over 5,000 years we have used it, so we can go with it against the propaganda of olive oil. So different guidelines have been put forward. I'll just highlight about the salt, very tasty foods, hidden sources of salt. We are very much fond of all this, but salt reduction is definitely helpful, and one must try that as per the guideline of WHO, that it should be to the tune of 5 to 6 gram in a day and not more than that, because reducing salt from 12 gram to 3 gram reduces stroke by 1/3 and CSD by 1/4. So this is a substantial benefit, and we should extract the benefit out of the salt reduction. Similarly, fish contains a lot of this omega-3 fatty acids. So naturally, this fish has been attributed as one of the important food and also has been promoted by the Japanese, and they attribute their longevity to the fish because of the omega-3 fatty acids. And similarly, nuts, they have got more of omega-3 fatty acids, but it is high calorie content, high fibers, so thereby it also has got a very salutary effect on our health pattern, or rather cardiac health pattern. Carbohydrate is another chapter. Again, I am not going into the detail of it, but definitely high carb diet ultimately gets converted to triglycerides, which has got its implication, and ultimately can also increase the various cholesterol levels, and thereby can be deleterious for the cardiac health. Protein, inverse association with protein intake and cardiovascular disease, and plant proteins, nuts and beans and tuna, rich in L-arginine, improves endothelial function, and dairy proteins appear to be beneficial. Current evidence does not support nutrients or vitamins, so I'm not going into the detail of it. Again, dairy products are somewhat helpful. Current evidence based on multiple meta-analysis show some benefits in stroke reduction, not in cardiovascular disease process. Same, fruits and vegetables, they protect against the cardiovascular disease and protect against the stroke, and that is why you must advise your patients that you take a lot of fruits and vegetables, and they should not be cooked. They should not be cooked. They should be taken raw. Dietary fibers, there are so many kinds of diets which contain a lot of fibers, and they should be encouraged. Egg controversy, you can take 2 to 3 per week, and that will not harm you. Mediterranean diet, another important thing, which is very much talked about, we can Indianize with the various kinds of drugs. Here is the importance of plate apportion. If you divide the whole total calories into different portions in the whole day, then definitely the calorie will be curtailed, and ultimately there will not be the various side effects of high calorie, that is obesity and stress and all these things, and you are going to have the good cardiac health. Now, again, I'm not going into the detail of the various guidelines because these are always talked about. So I'll end my talk by a sort of summary as well as a poem which has been written by me in honor of Dr. Rakesh Gupta. So that will be my last slide. Eat not salt, eat not pickle, lest they cause high pressure. Eat not rice, no free sweets, lest they cause sugar. Meat clogs the line, smokes asks for the price. Work makes it free, before a hurry think twice. Green veg, fresh salmon, hills are more edible. No whiskey, no rum, fruits makes life durable. Go, fried food, go. Boil yourself. Dress with olive oil or canola. Never ever reuse oil, fix up, touring in gondola. TV screens not at all keen. Avoid as much as possible. Cooked up news, dirty soap, make the brain cells horrible. Chat good, chant good, play with the family. Mind and body work together, relive mood properly. Give thy hands, give thy heart to whomsoever. Enjoy the earth, enjoy fully the life forever. Thank you very much.